Carpal tunnel surgery is a very short and very successful operation. The surgery is about releasing a ligament in the palm called the transverse carpal ligament. Doing this creates more room for the median nerve, allowing resolution of the numbness and tingling into the fingers that's associated with carpal tunnel syndrome. I choose to do my carpal tunnel releases endoscopically. This means I make a small transverse incision in the wrist, measuring between 1/4 inch and 1/2 inch, and I insert a camera into your carpal tunnel. Through the camera, I can visualize the median nerve and the transverse carpal ligament. After I ensure that the nerve is protected, I can elevate a small blade from within the camera to release the ligament, thereby creating more room for the median nerve. Endoscopic carpal tunnel release is a less invasive, safe, more cosmetic way to perform carpal tunnel release surgery. It allows patients a faster return to their normal activities in comparison to the standard open carpal tunnel release surgery. The surgery is most commonly done under a light sedation or twilight type anesthesia. It's the same anesthetic medication that patients typically receive for a colonoscopy. It allows you to keep breathing on your own, no tube in your throat, but you don't know anything about the operation at all. The surgery usually takes between 10 and 15 minutes. After the operation, you wake up feeling like you took a good nap. A bandage is worn on your hand for 4 days after the surgery. During that time, the bandage is kept drying in place. Following 4 days, the incision is waterproof and patients are cleared at that time to get the incision wet in the shower. Fingers are free the entire time after surgery, and I encourage patients to use this hand for daily activities, just limited to nothing heavier than 5 pounds of lifting. This means that the operative hand can be used for dressing, eating, shaving, driving, typing on the computer the day after surgery. Most patients are back to normal activities, including golfing, within 2.5 weeks or so of surgery. Symptoms of pain and waking at night with numbness are first to go away, usually within the first week or two. Numbness and tingling into the fingers most commonly fades away a little more slowly, typically over the course of a few weeks, even extending into a few months. The incision changes over multiple months following the operation. Patients end up with a very cosmetic result, an incision that leaves very little evidence of ever having surgery on their hand, but still with complete relief of the numbness to their fingers.